Hello, everyone. Thanks for joining us on the news briefing for this Wednesday. We will start off with our COVID-19 information. We have Dr. Moreno with us today. If there's anyone with questions for Dr. Moreno, go ahead and put them in chat. In the meantime, good afternoon, Dr. Moreno.
Yeah, good afternoon, Mayor.
So just while we're waiting for some questions in chat, I know we have had questions this week regarding new boosters that are available for Omicron. Are those yet available in Monterey County?
Hi, Mia. So regarding the new boosters, I think anyone who's interested in finding out if it's available and schedule an appointment should go to myturn.com. That's the place that they've been going to schedule their regular series and the previous booster. So that's where people should go to see if there are any available.
Thank you. I am not seeing any other questions in chat for you, Dr. Moreno. So we'll make it short today. Thanks very much for joining us on the briefing for that information.
All right, you're welcome.
Our next topic, we're going to talk about homelessness today and a really fantastic new program that is going to be hitting the streets literally very soon. It is an expanded county-wide homeless outreach and engagement program. The county is investing in this program. It's not a new program, but it's expanding. And we're very pleased to have two people here to speak to us about it. We have Lauren Suansupa with the Department of Social Services, and we have Cliff Andrews, who is the outreach manager for the Cal State Monterey Bay Community Health Engagement. Good afternoon and welcome to our news briefing.
Thank you, Maya.
So tell us a little bit about this program and when is it going to hit the ground running?
So I am excited to be able to have Cliff share a little bit more about the details of the program, but technically it is live and has been operating in our community for a bit of time now. Over a year, we first launched a pilot program, but as you were mentioning, it really is about expanding the services and providing coverage for more time. I think we often heard a lot of issues happen, very late on a Friday before a holiday weekend, and that the vulnerabilities of the people who are living unhoused in our community, they don't follow normal office hours. And we really also needed to be able to have a linkage with a group of people trained who have experience, who are able to go out into our community and into areas that may be challenging to access with the skills and the knowledge on how to engage. So I want to turn over to Clifford Andrews, who is the manager of the CHE Community Health Engagement, CHE Outreach Program. And he's got a bit of a presentation to share with you to announce to the public more about what this resource has to offer and how to access it. Cliff.
Yes, hello. My name is Clifford Andrews. I'm the outreach manager for CHE. I do have a quick presentation. I can share my screen and get started on that.
Thank you. Please do.
So we are Community Health Engagement, or CHE for short. And we are a nonprofit under California State University of Monterey Bay, or CSUMB. Our mission statement is to enhance and advocate for the health and wellness of unsheltered and underserved individuals in partnership with local service providers through community engagement and education. Our vision statement is to provide integrated, interprofessional, culturally resonant, and compassionate wellness services that foster a healthy place to live and thrive while promoting social justice for individuals experiencing homelessness in Monterey County and beyond. And we're primarily staffed by full-time employees consisting of CSUMB alumni as well as non-CSUMB alumni, such as bachelor students, graduate students, service learners, interns, and physicians. Our outreach organizational chart is Jackie Smith, who is our CHE program manager. And then myself, we have Addie, who is our outreach specialist. We have 6 outreach workers. We have 2 housing navigators that will go out into the field. And then we have an in-house case manager housing navigator. We have 3 MSW interns who are currently with the outreach team and 2 undergrads. Our objective, the main objective of CHE is to provide direct services to individuals and families who lack a fixed, regular, and adequate nighttime residence, which includes living in an encampment, shelter, or motel. We also serve as a community hub to offer people experiencing homelessness a safe place to heal, learn, and reconnect. The main objective of the outreach team is to serve the people who cannot come to CHE by providing field-based, client-centered services to individuals and families living in places not meant for human habitation in Monterey County. And the areas we serve, it's all of Monterey County, all the way up to the border of Pajaro, Watsonville borderline, and all the way south past King City towards Lockwood and Bradley areas, and everything in between. So Monterey, Seaside, Sand City, Carmel, Marina. So we identify individuals and families that require basic needs assistance and provide engagement at their residence, whether they're in an encampment, a tent, a vehicle, in a shack, in a motel. We complete needs assessment and CARS assessments. And CARS assessments are what we use to get a baseline of so their income, demographics, physical, mental. We assess them and see where how we can best support them. We complete referrals as needed. We support with tabling events and donation drives. A lot of the food and hygiene kits that we get are from donations. And we collaborate with fellow outreach teams, such as the city's outreach team, Access Support Network, and the youth team. So how the referral works is anyone can access the referral form. We receive the referral to check in on a new encampment via the form, or people can call in to our hotline at 831-208-6755. And we respond within 24 to 48 hours. And we call the referrer to give them an update on the referral process. We provide basic necessities. We build rapport with the individuals. We inform and educate them on local resources. We refer the clients to the resources and services if need be. And we also have tabling events a couple of days a week. One in El Estero along with ASN. So if they are not at their encampment, maybe they aren't available to receive our services when we go out there, they know where we're at tabling events. We do release of information. We conduct needs assessments and the CARS assessments, and we'll upload them on the same day. We obtain vital documents such as ID cards for them, birth certificates, social security cards, and ID cards are the biggest gatekeepers for individuals experiencing homelessness. So since we're a nonprofit under CSUMB, we're able to receive exempt forms so that they can receive an ID for free from the DMV. We also help them apply for benefits such as food stamps, SSI, SSDI, unemployment, and we'll help them complete housing vouchers. The way I think of it is, if you are a homeless individual, what do you need? And then how can we provide assistance to you? So all the way up to the housing navigation point, we start with our engagement, the basic engagement with building rapport, working on their vital docs and conducting assessments with them. We'll do the needs assessment, complete the CARS, other case management activities that we need to do. And we'll try to help them get a form of income so that way we can direct them to our housing navigators if they choose so to use a housing voucher or get housing assistance. So some of what we do is we prep on a weekly basis with food, first aid kits, and water, and these are all donations that we receive. So that we can go out to the field and provide them with some sort of some hygiene kits or something to hold them over if they're unable to access food themselves. So we have Tara and we have Addie. Tara on the left, she's in King City. She's about to get ready to go out into the field. We have Addie who's about to start checking out the tree line with other outreach workers as well. And not all encampments are in a city or a town. Some are off the beaten path. So as as outreach workers, we are willing to put on our boots, have change of clothes if need be with poison oak, and go out to these encampments where people don't really want the hustle and bustle of a town, and they prefer being out in these areas, but they still need resources. They still need their IDs, their birth certificates. Maybe they still need food stamps. This is King City as well. We're scouting to find some new encampments so that we can find people to provide services to. And like I mentioned, it's not always a tent or in a town, or even too much off the beaten path. Sometimes it's an abandoned building, so we can introduce ourselves and see if anyone is in there or nearby that we can provide service to as well. We also team up with Clinica de Salud when the pandemic first kicked off, so that we can team up and we can outreach to the workers around Chinatown and Salinas and see if they would be willing to get a COVID vaccine. And we started out in Chinatown, went to Sherwood, and went to a couple other areas where we set up shop and were able to do COVID testing, as well as later on doing the COVID vaccinations. In King City, there was a fire that happened down there recently. The family was misplaced. So while we were teaming up with other service providers, we were at a park, keeping them a bit busy until we could get the trailers set up, food resources, any other medical assistance that they may need, so that they can be sustainable. And we have MSW, with CSUMB's MSW program was able to get a clothes drive, and that's how we were able to get clothing for the homeless individuals for months to come. Picture on the left is when we're out in the Monterey Marina area. So thank you. That is Che's outreach team. Our office is located on 21 Soledad Street in Salinas, California. Our phone number is 831-770-1700. And I know we have a long email, but that's what we have right now. Yeah, that's the presentation.
Thank you, Cliff, very much for that thorough look at what you're doing. And Lauren, do you have something that you want to say to wrap up?
I just really wanted to just highlight and help, promote that hotline phone number. So I just wanted to reiterate, I think at the end that is the office line number. Please help us share to the community if there is a concern and they are interested in utilizing the outreach program to make a connection to somebody who may be in need. That phone number was the 831-208-6755, and that is the hotline that can help make the referral to the program.
Thank you, Lauren, and thank you, Cliff. I've got to ask this question because this program is not your average outreach. Typically, you don't see people putting on boots and poison ivy prevention to go out and help people. How will this type of outreach really connect with the people you're looking for?
Yes, so it's easier to receive services when you're in Chinatown, where there's more service providers. When you go out into the field, into Pajaro, or you go all the way down to King City, where there's not a whole lot of resources down there for homeless individuals, we can bring the services to them. We can bring the ID vouchers to them. We can bring the food, the clothing, their SSDI. Some people don't know how to even begin to work on unemployment or try to work on SSDI. And then when we bring it to them, we can come out with our tablets, meet them out into the field, even with our housing navigators, so we can do it right. We can bring the services to them instead of them trying to find a bus ticket or try to find gas cards or try to make their way up into areas where they do have these services.
And it also seems that you're making relationships for more, where you're reaching people who are entitled. These are people who are entitled to services, whether they live in an encampment or whether they live in a home. But I think is your ultimate goal to kind of get to know them and build trust and relationship so that they stop living where they're living and choose to live somewhere else.
Yes, and you will have a lot of people who do want housing, but we know Monterey County is not the most affordable. And some people choose not to have housing yet, or maybe they're not ready for it. So that's another thing that we can do with a needs assessment, is to see where they're at, meet them where they're at. Where is their mental health, their physical health? What kind of income do they have to navigate those housing units to maybe place them?
Anything else you'd like to share with us about the program? We're going to go ahead and post the hotline number and the email for the online referral form. Is that through the email or is that available somewhere?
Yes, we have the link for the referral form. I should have put that on the last slide as well. But yes, just clicking the link, and as soon as you click the link, the questions will appear, and it will ask basic questions about the location, contact number, maybe which city they're in, or if they're in a vehicle or a tent, the tent color, what kind of needs do they need, and what have they already have, like what they've worked on, if they already have an ID or birth certificate. But if that information isn't provided, then we can find that out ourselves. But yes, the best way, maybe Lauren would know the best way to give you the referral link.
Well, we'll make sure to pass all of that information along. We're just waiting on the final approval of a flyer too. We'll make sure that gets posted, social media as well, as soon as all of the documents are approved. But the hotline is valid now. The link, which we'll share with you, is working now. And so you're definitely able to communicate. The hotline and the referral link being the best to start, and then the office number and the email for any follow-up questions, or if you'd like to get in touch with Cliff for more information.
Thank you. And Cliff, thanks very much for sharing pictures of the work that your staff is doing. It's one thing to show the statistics. It's another thing to show what the work is really like. And, especially seeing those workers just doing something as simple as playing with children at a very stressful time just shows that this work can be very rewarding, not only for the people that are receiving the services, but for the people who are doing the work.
Yes. Thank you.
Thank you both for sharing about the program, which incidentally I hear is called HEART. It's short. Lauren, is that true? Is that an abbreviation?
That was the initial acronym. I think it was. Oh boy, I should have been prepared for exactly the acronym. Cliff.
So we the outreach team, as we're community health engagement, or CHE. HEART is specifically the outreach program, but we've kind of adopted CHE and community health engagement as the title. It's easier, so people out there don't have to think of two different names for different services.
It started off as the homeless engagement and response team, the HEART, and I think that it was trying to represent the philosophy and the approach that the team is trying to take in reaching out to the community, that it is really focused on rapport building, making that connection, and bridging the link between where somebody is at and where they'd like to be.
Well, you still have HEART, just not in the title that people have to figure out.
Yeah.
Thank you both for sharing about the program. We look forward to having you back to talk more about your success, because I know there will be some.
Thank you very much.
And thanks everyone for joining us on the briefing this week. Our next briefing is next week. We'll see you then.